This is Eye on the Community, and I am your host, Sean Anthony. Up next is Dr. Reversa Joseph, who is a board certified neurologist specializing in movement disorders and dementia. Dr. Joseph received her Bachelor's of Arts at Columbia University, medical degree at Georgetown University, and completed her neurology residency training at Yale University. She serves as the director of the Movement Disorders Clinic at the Chalmers P. Wiley VA and as adjunct assistant professor of neurology at The Ohio State University Wexner Medical Center. I want to welcome to Eye on the Community, Dr. Joseph. Welcome to the program. How are you?
I'm good. Thank you so much for having me.
It's
Thank
quite a
you.
pleasure. You have quite a deal of accomplishments, I must say. It should be inspiring to those out there that's listening. But Dr. Joseph, you're here to talk about this opioid epidemic. Can you briefly describe the current landscape of the opioid epidemic?
Yes, I can. And thank you. This is really a very important topic to be discussing today. What we're seeing right now is over 70,000, we've had over 70,000 deaths, opioid overdose deaths, since in 2019 from an opioid overdose. We've had about 1.6 million people in the United States diagnosed with a substance use disorder, so an addiction to opioids. And according to the National Institute of Drug Abuse, 130 people die every day from a drug overdose in the United States. 130 people. So you can see that this is a significant public health crisis. This is an issue, and especially looking at just in Columbus and just in Ohio. Ohio is actually one of the top states to, be suffering from this opioid epidemic. It's one of the top, of the top highest states with overdose deaths. And here in Franklin County, we had over 4,000 deaths in 2011, since 2011, from an opioid overdose. So you can see that we are as well suffering from this crisis here in Ohio as well.
Dr. Joseph, we often hear, opioids mentioned in media ad campaigns and, through social media. But exactly what are opioids?
Right, that's a great question. So we do hear this term often. Opioids are, it's a pain medication, and you've probably heard of medications like Percocet or OxyContin or oxycodone. These are pain medicines, man-made, that are very good to use for pain. And opiates, which you might have also heard that term, can be considered, it's would be made from the natural plant. There's an opium poppy plant, and morphine as well as codeine comes from that. So it's a natural source. But the other opioids that you've probably heard of, like Percocet or oxycodone, those are man-made or synthetic. And we use them, they are prescribed to be used for pain, to help with pain relief, and they're very good for that. Actually, in the late 1990s, the pharmaceutical companies kind of convinced the medical community that opioids were safe to use for pain and long-term treatment for pain, and that they weren't addictive. But we later learned that opioids actually were very addictive. Many patients began to misuse and abuse the opioids, and it was very addictive. But the medical community was misled by the pharmaceutical companies about that and began to prescribe them a lot to treat pain. So they were doing, a good thing, but did not realize that these medications were very addictive. And it looked like back in 2017, we had over a million people addicted to these opioid medications. So that's kind of how this public health crisis really began in the late
Dr.
90s.
Joseph, if you don't mind, I just want to follow up on something you mentioned.
Mhm.
Should the pharmaceutical companies be held accountable for misleading the medical community? I think that's really important. And they get off with a lot because they make billions of dollars.
Yeah, that's a great question. And there's actually, there have been cases, against one of the main manufacturers of the opioid medications in regards to kind of the mismanagement of the labeling around the opioids and really lying to the medical community that it wasn't addictive and they knew that it was. So, yes, they should be held accountable because there was a lot of misinformation going on about that.
Moving forward, how has the opioid crisis affected the Black community in particular?
Yeah, so this is something really, I think less attention has been placed in the African American community about the opioid crisis. I think a lot of attention and focus and the campaigns have been in, white suburban and rural communities about opioids, but we're actually seeing surprisingly an increase in the opioid use disorders with misuse, abuse, as well as opioid overdose deaths in the Black community. So there's a significant rise. And even here in Franklin County, we're seeing that as well. I think the latest data looking at just Ohio in general, Ohio was one of the top 5 states to have the highest opioid overdose deaths in the Black, in non-Hispanic Black, so in Black people. We're one of the
Wow.
five top highest states with the highest overdose deaths in Black people. And in Franklin County, we are seeing since 2019, we're seeing a huge rise in the increase of opioid overdose deaths in Black men. So
Mm.
this is a huge crisis here as well, that I think it's not a lot of attention has been placed on it, and we really need to do a better job with raising the awareness and the campaigns and things about harm reduction that we can do to help people, at least to try to prevent deaths.
Dr. Joseph, again, if you don't mind, if I just a little further into that, has there been any studies or information that shows why this increase in Black, particularly Black men, you said in the Black community,
Mhm.
have risen up with the opioid addiction?
Well, so what things are reporting out, at least since 2019, with the onset of the COVID-19 pandemic, that's played a huge role, what we can see from what we can see. Just the pandemic in general, in terms of, creating more social isolation, people were losing their jobs, so, loss of being in the workforce, things were shut down, and just increasing in the depression, and just so that just worsened, the mental health crisis that's already been existent. I think during COVID over these last few years has just worsened that, and that we're seeing that kind of play out, definitely with the increase in opioid use disorders and abuse as well as deaths.
Okay. Well, that you kind of answered my next question, asking about how the pandemic affected the crisis. What's the role of Narcan, and what exactly is that?
Yeah, so Narcan is a prescription medication that's used to basically reverse an opioid overdose. So with opioids, toxic, amounts of opioids can cause an overdose in which a patient stops breathing. So opioids can kind of depress or decrease your respiratory rate to the point that you stop breathing. And so with the Narcan or naloxone, that can be either injected with, as an injection or as a nasal spray, and that can help basically reverse the effect of that opioid overdose, so the patient can start breathing again. So then you can call 911 and then get the patient medical treatment in the interim. So it's basically a life-saving medication that, if you have a loved one or family member that may have an opioid addiction, having that around is life-saving for your family member or loved one. And also, if you are someone that also suffers from addiction, it's also recommended that you have that around as well. So this is a life-saving medication that we really need to increase the awareness about, for people to have on hand.
Absolutely. As we conclude, what are some prevention strategies that we could that could possibly be implemented to help reduce opioid abuse or misuse in the Black community?
Right. So I think one, just increasing the awareness about that this is a problem in our community. One, trying to, overcome the stigma that opioid overuse or, disorder or abuse of opioids is only in the white community, and that it's only in poor people or bad people. addiction is a disease, and it doesn't, it doesn't matter your race, it doesn't matter your socioeconomic status, it doesn't matter. Anyone can develop an addiction, and it is a chronic disease. And just understanding that since it is a disease, that it can be treated as well, and should be treated. And just encouraging those individuals to seek treatment for it. And it's okay to get help. I think often in the Black community, just as mental health issues, we don't want to go to the doctor about it. We don't want to, talk about, when we feel down or if we have depression, getting help, getting treatment for that, and that it's okay because, these are diseases, so, and they can be treated. And so, helping people just to kind of understand that, um, providing them with the resources that there are, outpatient, treatment centers, recovery centers for treatment, for them available, and just making them know that it's okay to get help.
Excellent. I can ask you tons more questions, but I definitely appreciate your time. Do you have any closing remarks or anything that you want to put out there for our listeners?
Well, I just wanted to highlight this past weekend. We actually had a community event called Uplift Her. This which is second year in existence, and we'll have it again next year. Usually looking for it around August. And this was an event to really uplift Black women and to spread the awareness, one, about opioids, and two, there were health screenings to help to improve the health of Black women. So we did mammograms, we did women's health screenings, we did blood pressure checks and diabetes for looking for diabetes with blood sugar checks and their cholesterol. And we were also passing out Narcan as well at that event. So, and then there will be an upcoming event for African American men, the African American Male Wellness Walk, which will be on August 13th, coming up next Saturday as well. There'll be screenings for Black men, can come out and get all types of screenings, health screenings available. There'll be a walk as well, and information too about opioid abuse and misuse, as well as Narcan passing it out as well. So that'll be a great event that you don't want to miss.
Thank you, Dr. Reversa Joseph, for the Ohio State University of Wexner Medical Center. We definitely appreciate your time sharing this valuable information on our in the community. You take care, okay?
Thank you. Thank you so much for having me. You take care as well.
Thanks.